This is Heart Rhythm TV, and I am Julie Shea here with a Heart Rhythm 2023 update. This year, Heart Rhythm 2023 is in New Orleans, Louisiana, from Friday, May 19th until Sunday, May 21st, which is a little different than our historical Thursday through Sunday schedule. So definitely something new for us this year. I know I am really excited for Heart Rhythm, and besides listening to jazz music and strolling down Bourbon Street and eating beignets at Cafe Du Monde, I am looking forward to all that Heart Rhythm 2023 has to offer. I'm very excited that the poster boards are back this year. Certainly missed that interaction last year. And with over 130 allied abstracts submitted, we should see some great science this year. In addition, we have 14 dedicated allied professional sessions. With me here today to tell us more about Heart Rhythm 2023 is Tara Mudd from the Program Committee. Welcome, Tara.
Thank you, Julie.
So, Tara, can you tell me a little bit more about yourself and how you got involved with the Heart Rhythm Society?
Sure. So I'm Tara Mudd. I work with Norton Healthcare in Louisville, Kentucky. I have been an EP nurse practitioner now for about 13 years. Clinically, I work in our AFib clinic, and then I also have a dual role administratively. I'm the clinical director for advanced practice for ambulatory specialty for Norton Medical Group. So have a little bit of a foot in both sides and have been with the organization now for I have been attending HRS probably for about 10 years or so. I started right after I became an NP just to kind of get as much knowledge as I could and have attended pretty routinely, both remotely and on-site. And always find it to be a really valuable source of information.
Absolutely. So can you tell us a little bit more about improvement subcommittee? So can you talk a little bit about how the program was put together and what's the value for the allied professionals attending the AP sessions?
Sure. So I was really excited to be able to work on this subcommittee. I think that my experience, both clinically and administratively, gives me a little bit of a unique perspective into some of the challenges that go into building a program. I think the HRS Scientific Sessions has always been a very robust meeting for learning the late-breaking things that are coming through research. But some of the struggles I think that we all interact with, whether we're private practice or employed or academic, is how to structure our program and how to incorporate all of these coming out on how to take care of patients. How do we make that into a care pathway that would be directly applicable to our patients? How do we go to our administrators and ask for things that we feel like our patients need? We've clearly seen in the data over the last few years the power of a multidisciplinary approach to treating patients with heart rhythm disorders. And so when we join together allied health professionals as well as our physician colleagues and our administrative colleagues, how can we really sit down at the towards the common goal of improving the care for our patients? So as part of the work for this subcommittee, we really tried to look at what are things that are happening right now that are directly applicable to us. So from an allied health standpoint, a lot of the changes with regards to split share visits in the hospital and how do we continue to operate as a team in the inpatient setting, still utilizing our advanced practice providers as well as our physicians and taking care of our patients. We are all very acutely aware of the recent cuts to reimbursement for ablation procedures. And so how do we restructure our programs to allow for the appropriate amount of volume, and looking at our compensation models and all of the various options that can be a lot overwhelming at times, I think, for a lot of providers. So as a subcommittee, myself, Dr. Deering, Dr. Silverstein sat down together and really tried to think about what could we offer our the participants of HRS 2023 that they could go directly back to their sites and use these strategies to help improve the care pathways for their patients.
That's tremendous. Thank you for that information. There's so many things that happened after the pandemic that we had to do a lot with process improvement. We had to reconfigure how we did things and how we worked as a team. So really looking forward. They sound like wonderful sessions for our allied professional members. What are you most excited about attending Heart Rhythm 2023 this year?
Well, I think obviously the setting, New Orleans, is a great place to visit. So like you, I'm really looking forward to just kind of the art scene of New Orleans. It's just storied in character, and just really excited for that. But also to get back on site. I've done remotely the last couple of years and have really missed being together with my colleagues. So I'm really looking forward to reconnecting with people that we've met via Zoom for many, many years here, it seems like. So I'm looking forward to that. And then obviously these sessions that we've really worked hard and just in my subcommittee, but being able to do other things across the board. I think we just have a great wealth of information to share with everybody this year. So I'm really looking forward to gaining clinical knowledge, as well as kind of some of the business aspect of this as well, and how I can come back and be a better clinician and a better administrator.
Great. And I was so excited to see that there were, close to 130 allied professional abstracts this year. So I'm very excited
Absolutely.
to listen to all of my colleagues' great ideas and innovation. And again, think back to our practice to improve patient care and outcomes.
Absolutely.
So Tara, thank you so much for joining me today
Sure.
to provide our members with an update for Heart Rhythm 2023. This is Julie Shea, Heart Rhythm TV, and we look forward to seeing you at Heart Rhythm 2023.